All right. Hello, everybody. So today we're doing this special Q&A with money being raised for the National Alopecia Areata Foundation. I've toyed around with donating to them in the past and plan to do more of it in the future. And what better way to start than now? So I already see someone donated $50. That's great. That's awesome. Thank you. I think that was before we even started the live. So here we are. Let me see. Hopefully everyone can hear me. My mic, okay, I think my mic is on. There are 26 people in here. Hi. Hello. Hi, guys. What can we ask? Yeah, whatever, anything. Anything, I guess, somewhat relevant to what I do or just anything. I don't care. I'm just here. I'm just here to hang out. Yeah, I'm married. Check out the last Q&A. You'll see my wife in there in the beginning. Yeah. Happily married with a child. Transdermal somatic cell gene therapy to reverse the age of skin. Oh man, that's that's gonna take a long time to talk about, and I'd have to read their studies. I'm not super familiar with that specific group, so I would need to look into that. Ethnic rhinoplasties, they take longer. Not necessarily. There are some specific, elements to them, but they don't necessarily take longer. Silicone, I don't like using silicone in general because they can get infected later on. Even 5, 10 years down the road, you can have an infected one that you have to remove, so I try not to put them in. Thanks, Rick. Appreciate that. Thanks, Mebra. Favorite surgery? I mean, I like all the stuff that I do. I do a lot of hair surgery and I do a lot of facial plastics, and each surgery is special to me. Have you considered plastic surgery for yourself? No, no. And besides a hair, I can't get a hair transplant. If you've been watching my channel, it's because I have an autoimmune condition that's not amenable to a hair transplant. But no, not really. In the last Q&A, I talked about maybe eventually getting some sort of lower eyelid work because I have a lot of deep hollows there, and as the pseudo herniation starts happening, I might want to get a lower bleph down the road, but not for a while. Med school, how hard is it? It's hard. I mean, it's challenging, but most people pass. P equals MD, as they say. But yeah, no, it has its challenges. Hi, Julie. There's cells at work. Episode about hair loss. His wife is lovely. She follows me on the gram. Adorable daughter. Thanks, Denise. Oh, here's Liz making her cameo. Liz, can you turn off the heat, please?
Oh, yeah.
Can fat transfer to the lips be melted? Not really. You're kind of stuck with it. You'd have to cut it out or suction it out. It's not so easy to get rid of. That's why I'm a little hesitant with fat transfer in general, honestly, because you can't get rid of it, and it just creates a fuller look that is irreversible. But it has its merits too for the face and for the scalp. People are doing fat transfer for the scalp these days too. 47 years. Oh, there's a lot here. Okay, I guess I should speed up. Oh, thanks, Molecular Bandit. That's really nice of you. Thanks for donating to the Alopecia Areata Foundation. Wow, there's a lot of stuff. I don't even know how to manage all these comments.
Okay, you're gonna need me to like.
Well, yeah, Liz will pick out any like noteworthy questions. I'm just gonna keep browsing through. OR, someone worked in the OR for 47 years. Okay, a facelift in the 1970s. Yeah, I'd rather not see it. I mean, the sad part is there are still people doing those types of facelifts today. And I hope you caught my facelift video from like 2 weeks ago.
There's a good one from Pseudo Morals. Did you see that?
No,
Do
what's the question?
plastic surgeons find natural faces more attractive, or is a perfected face more desirable once you're familiar with idealized outcomes?
No, for me, natural is still going to be the ideal face, but natural doesn't mean that it has to be an unoperated face. You can look very natural after surgery. So yeah, but in general, I prefer something more natural than like a distorted type of look. I do speak Russian reasonably well. I don't really read and write as well as I should, but I do speak it because I was born in the Soviet Union.
Question about referring to dentists for cosmetic dentistry and vice versa.
Oh yeah, dentists and cosmetic dentistry. One of my good friends is a cosmetic dentist. Shout out to Alex Schauman in New York City. And yeah, we refer to each other for relevant things. Yeah, I talk to my lip lift patients in particular about, like what cosmetic dentistry can or cannot do for them. Uh, again, when the time is right. Sometimes it's a little awkward because someone comes to me for a lip lift and they don't have straightest teeth, and I tell them like, look, I'm going to lift your upper lip. You're going to get more upper tooth exposure. Are you okay with that? And some people are like, yeah, that's great. That's what I want. And they don't even have necessarily the most ideal teeth. But then it becomes awkward. Like, do you mention sending them to a cosmetic dentist? They might get offended. But some people ask me, and sometimes I find a way to edge it in there without sounding rude.
We'll do some personal questions. What profession do you think you'd be in if you weren't a surgeon? That's a good question.
Probably something with like digital art, or I don't know, something more artistic, creative. Uh, yeah, something like that would be cool to do. Maybe architect, actually, architect and doing like digital things with like architecture programs, and I think I'd like that. I think I was good at organic chemistry, and not so much inorganic because of the three dimensionality of the molecules, and that's why I like surgery and the face in particular. It's very 3D, and I think like architecture is like that too, so that would be cool. Hold on, any advice for taking the MCATs? Oh man, I'm so far removed, Brian, that I don't even know what to tell you about the MCATs these days. I know they've changed the test since I took it many years ago. So uh, I don't know. I just know that you just have to kind of like go with the latest study guides and just kind of stick to do a lot of practice questions. Don't just learn the terms and the acronyms or whatever. Just do a lot of practice questions that'll help you.
How do you juggle being a surgeon and a YouTuber?
How do you juggle being a surgeon and a YouTuber? Well, it's just extra work. Uh, it kind of goes hand in hand, honestly. So I just finished preparing a talk for, well, like a video, but I flesh it out into essentially like a PowerPoint presentation on low level laser light therapy for hair restoration, and so it's kind of like just preparing to give a talk somewhere or a lecture, and but the more I read about it, the more I learn about the latest stuff. So it's a good way to stay up on the latest research, forces you to do the readings. And then I can like put it together and package it and deliver it for the YouTube audience. And it sort of like feeds back on itself because then people call us with questions and become our patients. And it's really nice. It doesn't really feel like separate. It just feels like an extension of my day job.
Another question from Elijah Bryn. What advancements in plastic surgery have you been most excited about recently?
Advancements in plastic surgery. These advancements happen very slowly. There are of course always like new robots and new fancy things, but oftentimes they're just like an incremental improvement on what we've been doing. I'm trying to think. I can tell you for hair, what I'm really excited about is something that I should be getting next month, which is the wireless WA system for FUE for extraction from Dr. Devroy in Belgium. As you guys probably know, I use his system. I did a talk with him as well, like a YouTube video where we talked about how he came up with the latest system. So I'm going to be getting that. So I bought the system. It's coming next month, and it's just cool because it's wireless and it's lighter. So I think it'll just facilitate extracting the grafts. So I'm excited about that, even though to many it's probably like a little stupid small thing, but I think it's going to make my life easier, which will make it better for patients, in turn.
And then
How much is an average? Hold on, Liz is feeding me questions.
I thought you wanted me to.
Yeah, it's helpful, but I'm gonna also take some myself.
Okay.
How much on average does a lip plus flip plus rhinoplasty cost from you? So for pricing, I always direct people to the office because the prices change and they're not the same like forever. So just reach out to the office. Check out our website, cityfacialplastics.com. Info@cityfp.com is our email. We have our phone number on the website. Just email us. That's probably the easiest way. info@cityfp.com, and just ask them, and they'll give you a ballpark range. Let's see. Okay, I'm gonna keep going down. Okay, Liz, go for it. We'll go
Oh,
back
so
and
you
forth.
do want my
I
help, or
t-
you?
I will go back and forth, back and forth.
Fine, okay. There was one that looked like a great question from Keandra, which was
Keandra.
favorite thing about your wife.
Oh my God, so many things. Well, we just had Thanksgiving at the apartment. We had our families over, and we had to go around and say what we're thankful for. So, of course, Liz was at the top of the list. And no, she's just very supportive. Like any idea I have, she won't like poo-poo it usually. She'll entertain it and give me like her feedback, and she's really supportive, super smart, and so it's very helpful for me and to bounce my ideas off of her, and to just like keep going with some of my thoughts and ideas that maybe aren't the most uh, I don't know, like traditional, I guess, like this whole YouTube thing and things we have planned, such as like I mentioned it in the last Q&A, but like crowdfunding surgery, which I've been really interested in, basically letting people get cheaper surgery by cheaper meaning like less expensive uh, by being able to like broadcast their surgery on, say, YouTube Live. So we're setting up for that, and I think that would be really cool. I think it's a win-win, well, for everybody. Of course, for patients who are willing to go public, a lot of my patients are not, and so they're not going to be on YouTube. But the ones who are open to it, they can make money back. So kind of through a similar setup as we're doing now, but instead of going to a, um, a charity, it'll be going back to the patient, and so we think that would be really cool. And we've been honestly partially inspired by Mr. Beast. I know it sounds crazy and maybe silly, but I think he has an interesting way about him. And I know he got a lot of backlash with like the recent Squid Games thing that he did, how much money it cost and all that. But he does a lot of charity work. He gives a lot of money back, and his general MO is just give everything back that he makes. And we function on kind of like a similar way, similar mentality. I don't have fancy boats or fancy cars, and so yes, I think it'd be cool to give patients money back through different ways. So that's what we're working on, and yeah, so it's those kind of, I guess, less traditional ideas that one might think is not the wisest, but Liz is always supportive, and she's a great mom. So all that and a lot more.
Do you want me to say one more? Because there's
Yeah. Okay,
Guy
Liz has
Groove.
another one.
Sorry, Guy
Okay.
Groove. Then this is going.
Guy
Guy Groove
Groove.
asked, "How do you decide when it's time for a hair transplant?"
How do you decide when it's time for a hair transplant? Well, you have to talk to someone like me, and someone who does transplant work. You're not really supposed to decide for yourself. So reach out if you're having hair loss, if you're not sure. I always welcome emails. We do like pretty quick responses. I'll tell people if I think they're sort of a candidate or not a candidate, and roughly how many grafts might work just through email without a consultation, and other doctors do something similar. So just reach out and ask, um, and that's the best way to find out. I mean, you're not expected to know, so just talk to someone who does this type of work. Recommendations for good plastic surgeons in Europe. Well, I had one doctor visit me twice actually, and I am in touch with him through like Instagram. Piotr Osach is in Poland. He's a very good surgeon, as far as I know. I don't know too many plastic surgeons in Europe, but I know he's a good one. He actually goes really out of his way to visit us here in the States, and to travel around to other places to continue to learn and advance all his skills. So I think he's great. Cosmetic leg lengthening will be as common as rhinoplasty. Uh, I don't know. I don't know. That seems like a pretty big deal. Probably a huge like recovery time, and you literally, I guess, have to be off your feet for that. So I don't see it being as popular as a rhinoplasty, but I guess you never know what trend will be next. But I don't see that really taking off. Um, but we'll see. Did Liz and I meet in university? I was a medical student in the city, and she was an undergrad in the city, so in New York City. So we were in universities, yeah, different ones. Yeah. What percent of your hair on your head do you need to qualify for success in hair transplant? That's a good question. It's a little more nuanced than that, I would say. First of all, it depends on what kind of hair loss you have. So if it's like what I have, you can't really get it. There's no hair to transplant. Um, as far as like androgenic alopecia, the most common type of hair loss, well, depends on like how big the area is that you're trying to fill and how much hair and how dense the hair is where you're trying to take the hair from. Usually the back of the head, but and the sides, but sometimes we can take from the neck, the chest, the back. So it gets complicated to answer that question. So that's why each person, kind of needs a tailored approach. The other thing I'll say is that like it depends on the expectations of the patient. Some patients expect all the hair to just miraculously reappear at the same density as when they were 16. That's not realistic. So, just trying to manage people's expectations, telling them what's possible, what's not possible, is kind of important. And on that note, hopefully tomorrow, we should be launching or uh, releasing our next video, and it's another hair transplant showcase, this time focused on the crown area. So one of my patients and kind of showing elements of surgery. So it would be, I think, interesting for you guys to see. We're trying to do more of those. And I just finished doing the prep work for an eyebrow hair transplant showcase because of Chrissy Teigen. And we already had a patient that we filmed. And, I kind of prepped that out. And hopefully, actually, tomorrow I'm going to go to the office on my day off and do filming, because you guys sometimes ask like, when do you get a chance to film? Well, you find time. So tomorrow, Sunday, which is Sunday, I'll be going in for like 3 hours and filming. So hopefully we'll get through that video, and that will be we're going to try to push that one because of the whole Chrissy Teigen thing, which will be interesting. What camera do you use to film your YouTube videos? So I've been using a Fuji mirrorless X-T20 with a fixed lens. It's a prime lens. It's a 35 millimeter lens, and that's been my setup. Pretty basic, but I've upgraded. I just haven't received the new camera, so I bought. It was a month or two ago now, 2 months ago. I purchased the Sony A7S3, but as some of you know, it's on back order, and I got a nice lens with that. So that will be my new setup, and I'm trying to outfit a space in our apartment to be able to film as well. So not just at the office, but it'll give me more flexibility because the new camera has a rotating screen, and it can film continuously. So that will be cool, I think. So that's going to be part of the new setup. Yeah, and I just purchased that 4K camera with a 30x optical zoom for my new exam room that should be installed hopefully in the next 2 months, and that will be really cool for filming surgical footage. Things that are done under local anesthesia, it's not in our operating room, and that's going to just produce like super high quality footage that we'll share with you guys. I'm thinking about a whole TikTok approach with that, but it also will enter into a lot of our other kind of showcase type of videos, and I think it'll be a pretty cool addition. So yeah, definitely looking always to kind of improve the quality of the video. You got something, Liz? Or
Oh, sure, yeah.
okay.
So here's this is like a different, kind of a different question. Do you think New York Magazine Best Docs is more political than a realistic evaluation of best doctors?
What do you mean by realistic
Like, do
evaluation?
you think? I think he's trying to say. This is Kenneth. Like, do you think like the
Kenneth.
New York Magazine list of best doctors is that accurate?
Okay, so here's the scoop, and maybe I should do a video about this, just exposing the industry a little bit, because like, I mean, I've been guilty of it. Like everyone has to do something to kind of get out there, right? It's like the whole PR thing. And the truth is, the more money you have to spend, the more you're going to be in every magazine that there is. They can essentially all be bought, and the better the placement, usually the better the connection. So it's not like you can call up the New York Times and say, I have X amount of money and I want you to include me in one of your articles on like plastic surgery. But you're going to work with a PR company that is going to be, say high powered enough to know someone there because, they have the connections. And they'll essentially over time, might not happen right when you start your contract with the PR company, but they'll eventually just push you through. And that's how that stuff works. So New York Magazine is no exception. Um, there's so many of them. There's so many of them, and occasionally. So I don't really now that I have you guys with YouTube. I mean, like that's been the best platform in my opinion to just kind of get my voice heard and do it in an honest way. Because a lot of the other methods through these like middlemen essentially, it's deceptive. It's deceptive. You're lying. You're spending a lot of money first of all, and then the stuff that's being put out there. Top 5 doctors in this, in this area. It's all paid for. Every single one. I mean, there's so few things that are like truly hand selected based on like specific metrics on what makes someone truly the best, or top 5 in their field. So it's really all paid for. I mean, hate to break it to you, but it is. And I don't know, was that the question?
I think that was kind of
Yeah,
the
so
vibe
so
of the
so it's very
question.
hard, I think, for patients to find like who's the best. I think you have to kind of do your own homework. Look at reviews, look at photos, look at we'll talk to people, see if anyone's heard of them, see if anyone's been to them. Call them, see what the process is for scheduling consultation. How does the staff treat you? It's all relevant. I think like from my perspective, kind of hiring people, and I have a small team, but uh, they're all very good. And like I'm hiring people who are a reflection essentially of me, right? Who I can get along with and who will treat my patients well. So if you call somebody and they have like a super rude receptionist, for example, that's not a it's not a deal breaker necessarily for that practice, but I don't think I would want to go and do something as personal as like say cosmetic surgery, or any kind of other surgery with that practice. So you just have to kind of do your homework, but it's very hard to go based off of like these media outlets. The other thing I'll say is like for what is it, the Castle Connolly top doctors, the one where it's like peer selected. I mean, literally, what most people do is like send around like a million emails, like, "Oh, please select me, and if you select me, I'll select you." So that gets really political too. And if you notice, there are a lot of academic and departments where like all their people are Castle Connolly top because they all select each other, and so that also has a lot of bias in it. It's very hard to figure out who's really a top doctor, who's just kind of just faking it. I don't know. I mean, there's lots of ways to also define top. Is it someone who does the most number of those surgeries? Is it someone who cares the most about their patients? Is it someone who, um, you know, I don't know, charges the most for the surgery? Some people associate that with being best. Very tricky, very hard to define.
And then there was another question that I thought was good, was that do you see, can't find it now, who asked the
We're trying,
question,
guys, to get
but
through a lot of these questions.
I think it was maybe Carolyn. Yeah, Carolyn Sullivan asked, can you tell differences, do you see differences in the skin of smokers versus non-smokers? Like during
Differences in
surgery?
the skin.
Yeah, when you operate or post-op?
Yeah, post, that's a good question. Smoking, what does it do to the skin? It decreases the blood supply. So when you're recovering from the surgery, in most plastic surgeries, we raise like a skin flap of some kind. And so in the recovery, like there's a more of like a mottled appearance to the skin because the vascularity doesn't get restored as readily as someone who's a non-smoker. So for sure, the skin quality is different. And that's why we tell people not to smoke like at least a month before and after surgery. People still do, and you can still get away with it most of the time, but sometimes it doesn't work out, and the healing is a lot poorer with smokers. Is buccal fat removal worth it for men, or should we accept the life of chubby cheeks? I've got a video on that, Lauro. Check out buccal fat removal. Just put that into YouTube, and I think you'll find my video. Uh, it's a story about why I stopped doing buccal fat removal. It wasn't, the right surgery in my hands, and I talk about that in that video. So check it out, and I think you'll have your answer. And just since we've been going now for like 25 minutes, and I don't know, we'll see until my voice gives out. I guess I'll keep going probably till up till maybe 10 or so. But just a reminder that this is actually for a good cause. This Q&A and last Q&A, I told you guys I was surprised people were like sending in some money, and I'm like, let's just put that to charity, and I didn't know how to do it, and we finally figured it out. So this is actually going to the National Alopecia Areata Foundation, which obviously I have the condition, as you guys know, so it's like near and dear to my heart, and we appreciate you guys donating through through us through this Q&A. So that's, I think, super cool, and I plan on giving back to them more in the future as well.
Oh, I saw another interesting question.
Okay, we got another interesting question.
Okay.
Thanks, Dad Sim. Love you too, man, or woman. I don't know.
From Elizabeth, do you see other surgeons as competitors or colleagues?
Do I see other surgeons? I'm assuming like plastic surgeons who do some. Well, okay, so I'll tell you what I think. Do I see them more as competitors or colleagues? Well, some I see as both. Um, and it just depends on like how much crossover there is. Most of us don't like, I should do a video on this too. Like, what is a plastic surgeon or a cosmetic surgeon, right? Like, my focus, my background, my original core training is in head and neck surgery, ENT. Then I did facial plastics, then I did hair surgery. So, and my practice focuses on facial plastics and hair surgery. So like there aren't that many people, I would say, around the world who have like a very deep um, like kind of know-how in each of those areas and focuses on them equally as much. A lot of people just do hair or they just do facial plastics, and that's cool. But I've chosen to kind of really try to keep them balanced in the practice. So there are some people who do both of that, but very few in general. But then, of course, like there are some surgeons who do a lot of hair, especially like a lot of the body hair stuff that I kind of sub specialize in. So you can't help but like wonder like, oh, well, why aren't those patients coming to me? Why are they going to someone else? Or if someone has a really nice result, you kind of like you're happy for them, but you're like, oh, that looks really great. I wish it was mine. So I think that those elements, like they definitely will kind of creep in of like there's the competition side, but the truth is like what I honestly believe is that like I wish more people just did good work, and the people who do good work, at the end of the day, I'm like happy for them. I'm happy that they exist sort of in the community, and even if sometimes I feel jealous or whatever, it's still just that's not the important thing. The important thing is that they're producing good work and they're treating patients well. And I'm fortunate to know, at least in my field, like a lot of like the top people for the specific type of surgeries that I do. And so I'm very happy that they exist. Some of them I look up to, others, they're just kind of whatever, they're like my peers, and I'm just like happy that they're doing good work, because there are a lot of people who do procedures that I do and they just don't do them very well because they don't care to put in the time, the work required to achieve the results and to like really know your craft well. So the people who have done that and who continue to push the field forward, I think that's great. I think that's great, and it almost doesn't matter, if they're how I view them. It's just the fact that they're there is great. William Foley, thank you so much. Really appreciate that donation. That is really nice. So hopefully that answers the question. But yeah, it depends on the person and the people who are at the top. I kind of know them, if not super super well personally. I've at least talked to them at a conference or two. And the people in the States. I mean, I don't know a lot of the folks internationally yet, but I'm sure with time I will.
Another one that someone wrote. How is this is Brandon Briseno.
Brandon, yeah.
How is pre-jowling treated in younger patients versus older patients?
Yeah. So it's really jowling. There's the pre-jowl sulcus, which is here. That's tethered down by the mandibular ligament. If you guys watch my facelift talk, but yeah, the jowling, it's tricky, right? Because in younger patients, I don't necessarily want to pull the trigger on a facelift, and so the options are somewhat limited, but what I advise is either a really good thread lifter. I refer specifically to one person, at least locally, who's excellent, Eunice Park. She's on Long Island. She's very good. Um, or you can try filler into the pre-jowl region to kind of mask that effect of the jowling. Uh, or you can do something like face tight, which is radio frequency energy. I don't offer that much in my practice. Oh, we got to get this question from William. He just like saw you donated. It's okay. But yeah, but those are the options, short of doing surgery. How do you feel the balance of your YouTube channel with running your practice is going for you personally? Good question. Listen, it's in a way extra work. So what I was telling my team recently, because we had a little powwow, because I think it's largely because of YouTube that we're just getting a lot more exposure, which translates to more phone calls and people booking consultations, which is phenomenal. I mean, we appreciate it so much, and that's always been the goal, to get to this point where things are just really rolling and sustainable, and I don't have to do, the fake PR crap, that I was mentioning earlier. It's true. I mean, Liz is laughing, but it's true. I mean, I much rather spend my time, instead of just throwing money away at PR. I'd rather spend my time at, free time, making like great content for you guys to learn, and then get patients that way, rather than, appearing as some sort of top doc, or being featured in an Allure magazine post because I paid a PR person who got my quote into the article. I mean, I much prefer that. So but as YouTube gets busier and picks up, and we keep wanting to kind of feed the machine, right? Because we're getting great feedback and everything, then the practice gets busier, and then it's harder to keep up with the practice, in the sense that I can keep up, but then we keep pushing our consultations back, right? So we're booking, I think, for May right now for a consultation, and there's no great like solution, because we already charge for a consultation, because when I wasn't charging for consultations back in the day, people just wouldn't show up. So we had a lot of people just, it was like no shows, and I used to actually reserve an hour of my time for every consult, and someone didn't show, and I'm like, oh well, I guess it's just me sitting around. And so now we do 30 minutes, and we charge, and it like everyone pretty much shows up, and we can be really efficient, and that usually is enough time for me to do a good kind of initial eval. And this is virtual. We do all virtual initial consults, and then people are welcome to come in person before making a decision, or sometimes I have to make them come in person because I can't tell through a video or photos, what, if I can offer them surgery or not. So yeah, but we've been scheduling out. So like we ended up raising our consult fee the other day to try to kind of slow things down a little bit and just get the people in who, are really committed, really interested, but I don't want to necessarily keep going up on the price of the consult. And one mentor of mine from St. Louis, what he's done is he's implemented a system where he screens pretty heavily his patients, but he's specifically looking for facial plastics, like facelift rhinoplasty candidates at his, where he's at in his practice, and he doesn't do hair, so that's all he cares about. And so he really can screen them heavily, and so it takes like a lot of questions and a lot of time with his team to even get on his consult schedule. For us, it's not as much, but the difference is, for hair, a lot of people just want to talk about their hair loss. And so it's not like I can screen them to say, oh, well, I only want the people who are going to get hair transplants because that's going to give me more money, because that's not really my goal. I just want to help people in the stuff that I'm doing, right? Stuff that I'm good at. And a lot of people feel like they just want to talk, right, about like why they're losing hair, what can they do? And oftentimes the answer is not surgery. So I don't want to cut those people out, if they just want to talk and if it's going to help them in their, journey. with hair loss. So we're just kind of in a way we're stuck. I mean, it's not a bad problem to have. I'm super grateful, but I also feel bad. Like there are people who really like they're ready to like schedule surgery. They want to get on sooner. And so the other way to do this is to just continue to build a bigger team, have more hair technicians, have more space. Manhattan is a tricky place. This is not like on one hand it's good because we have a lot of people with deep knowledge in different things, but to find good people and to kind of acquire those folks into your practice is not easy. And then training someone from scratch, especially in hair, is also not easy. So there's lots of challenges, and then space is expensive. It's not like space somewhere else where you could just buy a whole building, probably for the amount I spend on like one or two rooms in a larger facility. So there's lots of like I would say growing pains, but these are good problems. And then some people joke around and say, well, maybe just do YouTube. Like, why do you need to do all this clinical stuff and have headaches and just focus on YouTube because it's working? I don't think that's the answer either. I mean, I enjoy the clinical. That's why I trained all this time to do it. So I think I'm just going to continue to try to balance things. And I'm still at the hospital. I'm going down on my hospital time. I'll be there just once a week in the new year, but I'm balancing the hospital stuff too. My VA gig, and I love the VA patients. I love that job too, and it's like my only link now to sort of bread and butter ear nose throat stuff, which is my core training. So when I leave them, it would be like severing that tie, which is fine because my subspecialties are kind of like my focus now, but it's in a way it's nice to be tied to your past too and to the other skills that I have, which I don't actually talk about much on YouTube because it's so specialized. But I think I'm going to start to introduce at least some stuff, like maybe some inner nose stuff. I want to do a video on like nosebleeds, and I'm not going to really focus much on like ear and throat stuff really, but maybe inner nasal work is still relevant to the focus of the channel and the focus of my own practice.
There's another, this is a good question from Vince. Would you ever turn a client away if you felt they're not a candidate?
Oh yeah, we do. I do that all the time. I mean, not all the time, but often. I do it with like the initial kind of emails that I get, especially for hair, but other things too. Some people, they'll just email us, which is fine. We welcome that. What I don't want is for people to email us with like 1,000 questions and expect me to spend like hours, drafting an email back. I mean, I just don't have time for that. So hopefully people understand that. But sending an email with just like a couple of pictures and like brief thing of what you have in mind or what your goals are, I'll always respond, usually through my team, but like they'll forward me the email and I'll give a one or two liner about like what I think and what might make sense. But sometimes it's very obvious the person should not be getting surgery based on the story and based on their pictures. So I'll say that I don't think you need surgery. And then some patients, based on what they want, I'm not always the right fit, or I just don't believe surgery is right for them. And I'll tell them, I'll be as honest as I can. I mean, the worst is taking on a patient who you don't really want to operate on, but you end up doing it anyway for different reasons. Either they're like telling you, "Oh, you're the best thing ever," and like you're the surgeon for me, and you end up kind of saying, okay, maybe I can pull this one off for them, and then it's like always regrets. So it's much easier for me before we book anything to just say, what, it's just not gonna it's I don't think you need surgery, or I'm not the right one for you, or whatever the reasoning is. But yeah, I do that because it's much better than dealing with that after, the regrets, both that the patient might have regrets and then that I might have regrets. So yeah.
And then you want me to,
Yeah,
you
go
pick
go
the next
ahead.
one. You do the next one.
Oh, thanks, Carla. I just saw Carla donated. Thank you so much. What makes you not want to perform on someone? So unrealistic expectations is one. Another one is just they don't have the right anatomy for what we're trying to do. Like I've had people want to get a lip lift, but their lip is like up here, and it's twice as big as their lower lip. I'm like, it doesn't make sense. or a rhinoplasty where I think the proportions are like near perfect and someone still sees some little imperfection that I'm like, I'm not going to be able to make that any better. And I don't think anyone else will either. So, I kind of have to let them go. Or a hair transplant, or a person interested in a hair transplant who has like just nothing, like a Norwood 7, like really just nothing up top except for on the sides. And they tell me, I just want one surgery. That's all I want, one surgery, and I want all the hair restored. Not realistic. That's someone who's going to be very disappointed with their results. And so we tell them, sorry, we can't do that for you. So it's the requests of the patient have to make sense with, first of all, what my skill set is, and also with like what's doable for them, and if there's a mismatch, then it's better to not take them on. I'm getting a septoplasty. How do I tell my surgeon I want a rhinoplasty as well? Michelle, you just have to speak up. You got to speak up. I mean, I guess the question is, why are you getting a septoplasty? Is it just because you're not breathing well through your nose? And then if you're also having or wanting some cosmetic changes, you just have to tell them, it's a good time when you're doing a septoplasty to add on something cosmetic, because instead, some people, what they do is they just cut away the septal cartilage, the portion that's deviated, and they throw it out. That could be repurposed the same day to use as grafting for different cosmetic things. And you guys probably saw my recent video on the rhinoplasty modeling, where I show you where the grafts go and how that works. So yeah, so it's a good opportunity if you wanted something cosmetic to talk to your surgeon. So you just tell them. I mean, most surgeons are receptive.
Oh, and
Excuse me.
here's some. Oh, and we missed Ben's question. Ben Jameson had donated, and I missed it before. So it says, hi, Dr. Linkov. I have been greatly enjoying your videos. Could you discuss the specialized optics that you use during surgery, e.g., the magnifiers you wear on glasses in the thumbnail? Is it costly? Thanks.
Yeah, I wear Designs for Vision, and let me just get a cough drop. My daughter was under the weather, and it's kind of, my voice is slowly coming back, but sorry, it's embarrassing.
Oh, don't be embarrassed. Everyone.
Sorry, guys. So I use 2.5x loops, Designs for Vision, and it works. It works well. For hair, I've switched over to it's what's the company, Zeiss, and I use 3.5x for the Zeiss. So that's it.
I saw a couple questions about supplements too for hair, if you want to.
Hate itching throat. I know, me too. It's just been this past week. It's like I didn't even actually really get that sick, but like just this little stupid nagging thing. What else? Why is it less expensive overseas? Well, FUE is less expensive overseas because labor is less, cost of living is less. That's the reason. I mean, cost of living in Manhattan is like astronomically high, and along with like a lot of other parts of the states. So you have to charge accordingly, or else you can't run a business, right? So that's the main reason. Yeah, I mean, people are like, oh, they're greedier in the States. There's nothing to do with that. It's like you have to make a profit as a business, so you charge what you need to offset your costs. Good hair replacement surgeons in Toronto. People are always asking me. I know some of the folks in the States, and I don't really know too many. I know Dr. DeVroy in Belgium, excellent, came up with his own system, his own machine for FUE. I don't know too many people in Canada, unfortunately, but I'm sure they're out there. I'm sure.
Oh, look at Mr. Heron's question. That's a good one.
Mr. Heron?
Yeah.
When you're
He's
in
there.
public, does your mind go on autopilot mode and randomly notice people that make you go, "Wow, that guy would be a great candidate for hair transplant"? It's interesting. It's kind of like you can turn it on, you can turn it off. And sometimes I turn it on in public and I'm like almost practicing. I'm like, how many grafts would I do for this guy? But most of the time it's off, and I don't go around thinking like someone needs surgery, but there are times when like I'll be like, oh, this might be fun to like turn on for different times. But yeah, but I'll never go to someone obviously and tell them like, oh, I could do this for you. Autographs for fans. There have been a couple of people now in the city who've like recognized me, but no one's asked me for an autograph. I'd be glad to. Speaking of which, I guess with like merchandise, Marco tells me that people get into this whole merchandise thing on YouTube. And so we've had some people ask us for like sweatshirts. And I'm like, we don't have sweatshirts. But if you guys are interested in that, let us know and what we should start with. Should we start with a cap? Should it be a t-shirt, sweatshirt? And we'll look into it. Have I ever had work done? No, honestly, no. No, I don't. I have good skin, I think, from my mom. I don't really, I'm not, I don't know. I'm not like frowning all day. So no, not yet. I'm sure eventually I will. Most of the surgeries in the office. Yeah, most of my surgeries are in the office. They're in the actual like office setting, like a procedure room for all the local stuff. And then for the like general things like rhinoplasty, facelift surgery that require general anesthesia, we have our own operating room down the hall from my exam room, so it's convenient. Anonymous, thank you. How old are you? So I am 35. I'm 36 in December. So coming up, less than a month.
I'm laughing because why are you like the most laid back doctor? Like you're not always
I don't know.
laid back.
I'm not. No, like that's the thing. Yeah, like I'm very like hardcore when it comes to my work. But in general, I guess I'm somewhat laid back. But like I'm pretty crazy when it comes to like things being done right, which I think is good for patients. But as my wife knows, like if I ask for a specific bagel and you get me the wrong bagel, like I'm gonna be pissed. So I don't know. I'm relaxed, I guess, in some respects. Yeah, Paul Nassif. Yeah, I mean, I've met him before at conferences, and yeah, I've watched the show here and there. I mean, I don't binge watch that show, but yeah, we'll look young forever. Yeah, we'll see. Maybe with the bald head, I guess. Like, yeah, maybe. Youngest age someone should have a hair transplant? Good question. I wouldn't do it on someone under 18 just because then, they can't consent for themselves. But what people forget, it's not just an age thing, like it's really the pattern of hair loss. And there are some 19-year-olds, even 17-year-olds, where they're almost a Norwood 7, 6, 7. There's no reason why they can't get a hair transplant, if they understand pros and cons and all this stuff. So I've worked on patients as young as like 19, 20, but it has to be the right person. I mean, we're not talking about someone with a little bit of a frontotemporal recession. We're talking about someone who has very advanced male pattern loss and, the family history to support that. So it's not just an age thing. You definitely, for someone with not much hair loss and on a younger patient, you have to be super conservative and generally like tell them not to do surgery until later. But there are exceptions. Do you think Michael Jackson would have gotten better results had he done his rhinoplasty in 2021 with the latest knowledge in the field? It depends. Yeah. I mean, if he went to someone who was like a structural rhinoplasty surgeon like myself, then yeah, I mean, we wouldn't create the stuff that he had back then. But honestly, like if his goal was to just have the smallest little button nose and whatever, then you know you'd find someone to do that. And when you remove all the support of the nose and create a little tiny nose, generally not going to breathe too well. Thanks. Excellent spirit. Thank you. Excellent spirit. Yeah, I agree. I wasn't the one who got the bagel order wrong. Oh, that's yeah. Would you operate on someone with body dysmorphia? Well, I once did I forgot what kind of, maybe it was a lip lift or something on a patient. And then, like, in one of the follow-up visits, he admitted that he has BDD. And I'm like in passing, he was like, oh, yeah, I'm going back to my rhinoplasty surgeon because, I have like BDD. And I'm like, what? Why didn't you tell me before I did your surgery? But luckily, he was, I guess, happy enough with the surgery that I did. But of course, if I knew that beforehand, I would not do that. And we always have our antenna up for that condition. But sometimes you get fooled. I've been fooled in both ways. I've at times resisted operating on someone and somehow just said, I'm just going to do it, like because they were pleading and oh, please it, and it went fine. Surgery went well, recovery went well, the patient was happy, and they didn't really cause any problems. And I don't know. So it's hard. It's hard to always know who not to operate on. So yeah, I don't know. It's tricky. It's definitely tricky, and we've all been wrong before. All of us plastic surgeons. They're yeah. It's you can't get it right every time. You just can't. Because if you have such a high threshold to offering surgery, first of all, you're going to run a business like that. I mean, if you're just like operating once a year, finding the perfect person to operate on. Secondly, like you just don't know. I mean, there's so many different personalities out there. It's not always a perfect personality match between patient and doctor. So you just oftentimes hope for the best, and sometimes you don't pick wisely, and then you get a patient who gives you a lot of problems. Like I think what people don't realize is that um, you could get like you can get a complication from surgery, but a good patient is going to be understanding and is going to like feel like you did your best and shit happens, and they're going to work with you and you're going to work with them ideally to make things right. Someone who's unreasonable, even with a nice result, like objectively nice, like if you showed 100 people their result, they'd be like, oh yeah, great, that looks great, that's a nice improvement. They'll pick up on something like the smallest little sign of a scar or the fact that they had swelling for an extra week, and they'll complain about it, and they won't stop complaining about it, and then they can go and write a bad review or whatever. I mean, those people exist, and it's really tough because when you get stuck with someone like that, it doesn't matter how good of a surgeon you are, it doesn't matter how nice you are, it doesn't matter how well you're treated by your staff. They'll create hell. But we all know people like that, right? Checking into hotels, being in restaurants, just being on like a bus, like there's going to be people who act out. And sometimes those people end up in a plastic surgery office and they act out in that setting. Um, Very different from someone, and again, I'm talking more like from my perspective, looking at patients, but from a patient's perspective, you also want to pick a doctor who cares, who's not going to, there are doctors out there who just think every result they have is perfect and they're not going to give you the time of day if you come and complain about anything. So I'm not talking about someone coming in and saying like, look, I think this is an improvement, but I still see something, say it's on my nose or on my eye, that I'd like to tweak further. That's fine. Revision surgery is very common in plastic surgery. But it's different from someone who nitpicks at every little thing and just creates hell for you and your team.
Can I say something?
Thanks, Karen. Yeah,
Okay,
Liz has
so
something.
someone AKG wrote, "Hi, Dr. Linkov. My son has alopecia areata as well, as he somehow found your channel and thinks you're great. Maybe
Thank
you
you.
could, I don't know, say something to her
What's her son's
son."
name? What's her name?
AKG.
AKG. Well, thank you so
Just
much.
like,
Yeah, no, I mean, I feel for um, people who develop this condition. I don't know how old your son is. Maybe he's my age or whatever. I don't know, older. But if he's much younger, definitely it's so much harder to go through this when you're younger. After a while, you kind of learn to kind of have coping mechanisms that help you. But when you're young, you don't have that yet. So I really feel for people who are much younger and develop this universalis situation. where you just look different. You look different from the rest, and uh, there's not enough patient education out there. So I try through this channel, as you guys know, to teach and kind of raise the awareness. But a lot of people have no idea what it is, and so they just think, I don't know, you have cancer, or they think you're weird because you're shaved or whatever. I don't know. So yeah, definitely feel for your son and wish him all the best. And if he ever wants to reach out for anything, please do. What do you think about doing blood tests to assess for risks of side effects prior to starting finasteride? Most people don't do that. I mean, what are you going to check for? You can check for testosterone levels. You can, lower levels might indicate potential for higher risk of side effects, but most people don't do that. Uh, you can. I mean, it's an option, but I don't. I'm not a big proponent of that. Breast implant illness, Glitter Girl. I'm not the one to ask, honestly. I'm so like subspecialized in face and hair that I don't know the latest on breast implant illness. Um, and I don't pretend to be an expert on anything medical or anything, even plastic surgery. Just kind of focus on the stuff that I know well. So I don't know. There are bad doctors, but there are also unreasonable patients. Correct. Exactly. Right. There's bad doctors, there are bad patients, and then versa, and the opposite is true too. No, ACell has not been truly shown to help much with hair transplants, nor does it do much with PRP. So I don't offer it. I used to offer it because patients would ask for it. And then when I ran the literature, I was like, this is not that helpful. So I stopped offering ACell. I don't think it helps much. Cheek implants or filler. Cheek implants are just so tricky. I've stopped offering them. I never really did a lot of them, to be honest with you. Uh, but they're very. I've never heard of someone getting cheek implants and just being happy. People are always disappointed. One side is always different from the other because we're all asymmetrical, and then it's impossible to match the implant to exactly then mimic the other side. So these people who get these implants, they're constantly looking and assessing, and they're seeing these differences, and they're not happy. And I've just avoided it. So I think filler, even though filler has its issues too, but doing nothing also is not great, right? Sometimes. So, but I'm not an implant fan for cheeks. It's also more challenging to revise compared to like a chin implant.
Oh, another question, or a statement someone wrote from ITR Gaming. I'm scared of the pain. I need an FUE, but man, I am just scared. So maybe you could talk about
Yeah,
pain
with a hair
FUE.
transplant. Look, there are going to be some needles, and we give Valium and Ambien to calm the nerves in the beginning. So most patients are more relaxed by the time that we actually start with the numbing. But it's you feel it going in, and it's a bunch of pokes, and then it goes numb. So I think you can handle it, and most people are fine. But the initial discomfort is there, and you can use different like devices, like vibrational devices, to trick the brain, so you don't perceive the pain as much. We don't, because it's pretty quick to get it numb. But yeah, I mean, you have to know yourself. If you're too scared, then don't do it. You can also theoretically get like IV sedation, but you don't want IV sedation for an entire hair transplant. It's too much time to be under IV sedation. So potentially getting IV sedation just for the beginning part is doable, but then you'd have to bring in an anesthesiologist, and in our practice, we'd have to then do that in the operating room. So now your costs are going up, right? And the transplant's already expensive. So like, yeah, but that's the other way to do it.
And then another just along the hairline. Absols asked, "Hey doc, what advice would you give a young person, early 20s, whose hair loss continues and does not stabilize even after using finasteride and minoxidil?"
So if it doesn't stabilize, again, it's a case by case basis. So If it's getting really, I mean, you don't want to do a transplant when there's aggressive loss, right? You want some degree of stability. So if it just continues to, you continue to lose hair rapidly despite all medical therapy, you have to be very, very cautious with a transplant. Beyond that, it's just a case by case. Ben, thank you very much
All right.
for the donation.
It's been an hour. I think it's.
We'll go 10 more minutes. We're gonna go
Oh my
into
God.
bonus. We're gonna go into bonus. It's for a cause, Liz. It's for a good cause.
But it's okay. All right, whatever you want to do.
What's the best way to review hair surgeons? It's tough. I mean, you can try the ISHRS. I'm in the process of like becoming like a full member. They just want you to do like a bunch of cases over many years, right? Because they want to keep it exclusive. So, I'm kind of going to be submitting all my stuff to them at some point. But you can do that to pick someone. I mean, like there are good people who are not ISHRS members, but most members who are ISHRS, they at least know their basic stuff. They may not be the most artistic, right? Like it might be hard to find that just by looking on their website, but they're going to be following all the basic tenets of hair transplant and doing it at least in a safe way.
Oh, we missed Karen's question. What approach do you take for chin implants, in the mouth or under chin incision?
For a chin implant, underneath, different ways to do it, but generally underneath for me.
And maybe a patient of yours said he had an operation with you earlier this year, Steve Pierce.
Oh, Steve, I don't know.
Did not with Dr. Linkov earlier this year. Highly recommended. Thanks, Gary.
Oh, okay, cool. Thank you. Yeah, Steve. Okay, awesome. Thank you. Yeah, you need to be an artist and at the same time a surgeon. Yeah, I agree, Vince. Yeah, I think there's a lot of artistic elements that go unrecognized sometimes. LaFour 2, usually that's going to be done by like an OMFS surgeon, oral surgeon. I think it's possible to to get nice results and keep it relatively safe. I just don't do that surgery. Do hoodie merch, please. Okay, so Michelle, should the hoodie have like, I guess, just our logo on it? Should it have like some sort of phrase on it? I don't know. I guess a hoodie should be pretty simple, right?
Let's see.
We'll do something. Can I come to you for liquid rhino? You can, Ali. Liquid rhinoplasty. Ocular plastic surgeons. Yeah, I can give you a couple, but liquid rhinoplasty, I do offer. I just don't do it that much anymore because we're focused on surgery for the most part of my practice now. But I'll still do the occasional liquid rhinoplasty. In terms of ocular plastic surgeons, it depends what part of the country. I know a lot of good ones. Locally in New York City, I recommend James Chalmers, Brett Cotlis, Irina Belinsky. Those are like my 3 that I send patients to. They're all great. Ty Tunes, thank you. Thank you so much. Wow, $50. That's crazy. Thank you so much. That's great. Can't wait for the Alopecia Areata Foundation to get this money. That'll be cool.
Dawn asked a question. How often do you include body fat transplants infusion when you do a SMAS facelift? Is this standard or no?
No, fat transfer. No, like in the beginning of this Q&A, I briefly touched on it. Not like a huge proponent of like doing fat transfer all the time and anyone who wants it, because that fat, 50% of it goes away, gets resorbed. So you don't know which 50% is going to make it. That's A. B, it's going to maintain or retain a lot of the qualities of where it came from. So from the belly. So if you were to gain weight, one of the first places where you're going to now see it is the face. So it can be tricky to control it over time, and it's hard to like remove it once it's in there. So I think someone who's really, really gaunt and kind of like thinned out, you can consider doing it on, but I don't routinely do fat transfer on every facelift. if you're repositioning the face, let's say a deep plane, you're getting that fallen material, fallen tissues back to where they were, and you're improving the volume in at least the lateral cheek area. So it's not always necessary, I would say.
And then Ben had another question too, right under that. That was, where did it go? Pharma treatment. How has pharma treatment of male alopecia changed over the last 15 years? Is finasteride used temporarily now?
No, I wouldn't say temperate. And there hasn't been too much change in 15 years, unfortunately. But yeah, no, it's finasteride is still something that some people are on kind of indefinitely. I mean, it's kind of crazy to think of it that way, but it is true because, again, it's if you care about preserving the hair. And there are other medical therapies out there, and we talk about it on the channel. And tomorrow, hopefully, I'll get to film the low-level laser light therapy talk, and that we'll put out in the next few weeks. And that's yet another modality for medical therapy for people who say don't want to risk the side effects of finasteride. But it's still, I think, the most effective treatment that we have for medical therapy.
There's a couple of people asking about mewing for jawline and cheekbones. I don't know what mewing is.
Not super familiar with that. Mewing. I don't know. Look it up. I'm not sure. I don't know what mewing is to create better cheekbones. I don't know. Your videos are interesting to watch, even if someone doesn't plan on getting plastic surgery. Your channel's great. Thank you. I know mewing. What is mewing? Not too familiar with it. Do you mean sewing? Do they mean sewing? Yeah, Tino, other than the hair loss, I feel great. Yeah, I'm healthy. I know sometimes people don't think I look healthy, but I am healthy. Ooh, is turkey safe? Please, doc. Drunk auntie, I'm assuming you're talking about hair transplants. It can be safe. It can also be unsafe. You just have to, I guess, know the clinic well. I don't know how you would know the clinic well unless you had maybe friends who've been there before. But it can be tricky. Mewing is having your tongue on the roof of your mouth.
They're like exercises.
Yeah, like an
tongue
exercise.
exercises.
Yeah, it hasn't really been shown to help in the kind of long term. Maybe short term, it feels better, feels lifted. I don't think there are truly any long term gains from that. But I know, there are people who believe in it. So one of the other videos I plan on filming tomorrow is about neurocranial repositioning. So these are chiropractors who put essentially these inflatable balloons in your nose, and blindly they just like blow them up and expand your nostrils, and they say that they're creating more space in your facial bones and all this garbage. And it's like, yeah, maybe temporarily you feel like you're breathing better, but first of all, you don't know what damage it's causing. I mean, obviously putting your tongue up to the roof of your mouth is not going to cause any harm, but just as like an analogy of some other alternative type of treatment, there's zero data to support anything that they're doing, and there's actual real harm when we're talking about balloons blindly being put into the nose. So that'll be an interesting video once it's filmed and it comes out. What else? Okay, a few more minutes, guys. Let's see. Joshua, if someone created a 3D sculpted image of what they wanted their face to look like, would that be an accurate way of communicating to the doctor the patient's desired appearance? Yeah, but people are always sending me like photos of like models and celebrities or their own like versions of what they want to look like. Oftentimes, you have to just work with what they got. And I think when the patient is doing their own like photoshopping essentially or editing, uh, I don't think they're doing it with like an actual surgical move in mind. When I do modeling for the nose, let's say, or photoshopping before surgery, like I'm making a change, but I'm thinking like, how am I going to make that change in real life? Not just like, how do I make it look prettier? So it's kind of a different perspective. So I think it's better to just find a surgeon who shares the same vision as you.
Maybe last question
Thanks, Flora.
from Ty Tunes.
Oh, Ty Tunes, yeah,
yeah.
with the big donation. 15. Wow. COVID last year. Lost a lot of hair. It's almost back. Good. It's telogen effluvium. Yeah. Yeah, it's normal. It's basically it's any virus can do it. It's called telogen effluvium, and usually within about a year, most of the hair comes back. So I'm glad you're doing better. One more minute. Have you ever encountered patients who have gone into debt from plastic surgery? Yeah. I mean, I think some people are uh, spending their last money on plastic surgery. I don't think I get too many of them, but we've had patients where they paid a deposit to reserve a date on our schedule, and then they literally like when the time came for them to pay the rest, they're like, I don't have money. Like we have to push off the surgery. So yeah, I mean, I don't know if they're going to debt per se or they just don't have the money sometimes. But yeah, I mean, that I guess it could happen. Otolaryngologist does perform rhinoplasty sometimes if they have advanced training. So, like, I am an otolaryngologist who did additional, complicated kind of training, and then we do that. So, yeah. Do you see yourself getting surgery one day? Yeah, maybe. The question comes up a lot, but yeah, no. Thanks, anonymous. Maybe one day.
How'd you meet Liz?
I want to do a consult with you ASAP for my revision rhinoplasty, upper bleph, classic strong European bridge. Sounds good. Our consults are booked out into May, as I said earlier, but we have a cancellation list, so give us a call. Email info@cityfp.com, and we'll figure it out. What made you go into medicine? Like I just thought kind of was like all the way back to when I was a little kid, and that's all I talked about. I don't know. I think we had some family friends who were doctors, and I just wanted to be like them, and it always felt very natural. Always liked helping people, and I don't know, it just felt right. But I didn't always know. Like I thought I wanted to be an eye doctor for a long time, and then in med school I had a week rotation on ophthalmology, and then a week on ENT back to back, and I just liked the ENT stuff more. I thought it was just more interesting, and it involved some microscopic surgeries and then some bigger surgeries. But yeah, no, I don't know. So that's I just went down the ENT route and was always interested in art and um, and then got into plastics for the face and the reconstructive stuff and the cosmetic stuff. So what people don't realize is like my training, I did a lot of like trauma work, facial trauma, like gunshot wounds, like broken jaws, like all this stuff. In my private practice, I don't deal with any of that, and so it's almost a little sad because I have these skills that I just don't always use. But this way I'm able to focus in on very specific procedures and do them as well as I can.
All right, we got one last question.
One last question. Let's make it good. I'm going to look through a bunch of these. Oh, eyebrow transplants. Kelly, good one. So that's another video that's on my list for tomorrow morning to film. And that one, so it's because this whole Chrissy Teigen thing that I wanted to get this video out, but we filmed it a while ago, and it's one of my patients. So yes, short answer is yes, we do them. But it's like an actual surgery showcase we're gonna put up there, and it's a FUT, eyebrow hair transplant. So we'll be putting that together. I'll hopefully film like the video, like my portion of it, where I'm like reacting to my own surgery tomorrow, and then we'll put the video together for YouTube. I think we wanted to do it next or the one after next. I don't know. Maybe by next weekend it'll be out. So tomorrow or Monday, be on the lookout for a crown hair transplant showcase of one of my patients. Then we're going to be doing an Andrew Garfield. Andrew, right? Yeah, Andrew Garfield. His hair, like my opinion on what he's had done or has not had done with his hair, because there's been speculation as to whether or not Spider-Man had a hair transplant. So I'm going to go into that. So I think that one's maybe for Wednesday. And then for next weekend, we'll probably put out the eyebrow one. So lots of videos. $300. Yes. Yeah, that's great. I'm so happy. Good. It's for a good cause. And thank you guys so much. What else? I did live. Yeah.
Hey,
Cool.
I thought it was cutting you off. It's
No, that's it.
10:15.
That's it. This is like, I don't know. It's addicting. All right.
You have to
Someone
get
wrote,
rest.
thank you, doctors Linkov and Linkov. Thank you, Ben. Guys, it's been a blast. We will, I love you, bald and eyebrowless.
Mutual
YouTube,
friend.
Doc Crush.
Mutual friend, Allie. Okay, that's it.
Thanks, guys. No, honestly, like, so during the, so I mentioned the last thing, during the Thanksgiving thing that we had at our place, like during the meal, we went around, everyone said what they're thankful for, and Liz can attest to this. But after Liz, it was like my daughter, and then it was my parents, and then the rest of my family that was there, and family that couldn't make it. And then after that, guess what came after that? Guess what it was? YouTube. And the reason I brought that up is because it really has given me a voice, and it's really thanks to all of you who, are, I guess, the more diehard fans of the channel, because you're here on a Saturday night. So I really, really appreciate it. It's been amazing to just get my story out there. I think it's helped me cope with my own condition, and it's allowed me to just work ever harder to educate and to, then have that feedback into the practice and do good work. So again, super, super thankful for all of you and for the platform for allowing me to do this. So thanks again, guys. Have a good night. See you. We'll do this more often. It's actually thanks to Liz. She gets me to do these. I enjoy them, but it's like I also want to watch a little Netflix. I don't get to do that too often.
We'll
So.
finish Red Notice.
Good night. We're trying to finish Red Notice. This is like attempt number 4. Good night, guys. Hope everyone enjoyed their Thanksgiving, and hope everyone's enjoying the weekend. Bye.